Assalamu alaikum. Welcome back. You're listening to the Mari Mukwanda Show on Slam Media. It is time for our Women's Health Tuesdays. And today, Dr. Tom will be giving us some more insight on ectopic pregnancies, what it is, how it's diagnosed, what are the treatments involved, as well as the symptoms. If you have no idea what it is, stay tuned because that is what we are going to be talking about. Dr. Tom, a good afternoon.
Good afternoon. Good afternoon to you and your listeners.
Thank you for joining us once again, Dr. Tom.
It's my pleasure.
All right, so Dr. Tom, what is an ectopic pregnancy?
Ectopic pregnancy essentially means a pregnancy which is not in the womb. So on average, the pregnancy, not on average, but the normal circumstances is that the pregnancy is supposed to be inside the uterus.
Mm-hmm.
But if it's sitting outside the uterus, which can either be in the cervix, in the fallopian tube, in the ovary, or even in the abdomen, it's called an ectopic pregnancy.
Mm-hmm.
So, and people get surprised that how can a pregnancy grow in the outside the uterus or in the abdomen? So the times you get a pregnancy which gets attached to the bowel, to the intestine, then it gets its blood from there. So essentially, it's a pregnancy which grows in the wrong place.
Mm-hmm. So pregnancies that grow in the wrong places, like what you're describing, the ectopic pregnancy, how can they develop? How do they? How long do they last?
Very good question. When the pregnancy grows, let's say it grows in the tube. The tube is a very small place, so it cannot be able to grow more than a particular place, a particular stage, because the tube is a very thin space where the egg, which has been fertilized, flows through. So most of the time, if a pregnancy is growing in the wrong place, in this particular case, in the fallopian tube, it may not be able to grow most of the time beyond 5 to 12 weeks, because by then it will rupture because the space is very small, it's a confined space. However, in the very rare instances where the pregnancy grows outside the tube and is getting its nutrition from the bowel, it can actually grow to up to 8-9 months.
Mm-hmm. Right. And how would you know if you have an ectopic pregnancy?
Now, one can only suspect that they have an ectopic pregnancy. When the pregnancy is growing outside the tube, if one has missed their period and the pregnancy test is positive, two, they're experiencing unusual pain, which is in pregnancy, some women do experience pains, period-like pains, but if the pain is unusual, it's very severe, or that pain is also associated with bleeding, one can only suspect, because one may not be able to know that, the pregnancy is outside the womb unless a diagnosis is made. So anytime somebody's pregnant and they're experiencing pain in the abdomen, it's always good to see a healthcare professional who will be able to examine and probably make the diagnosis of either pregnancy inside the womb or outside the womb.
Mm-hmm. All right, so take us through the diagnosis.
Now, the diagnosis normally starts from the history. So somebody will come to me because they have missed their period, the pregnancy test is positive, and they're having pain. So in a case, we call that the triad of ectopic pregnancy. So when that happens, we will suspect that it could be an ectopic pregnancy. But the exact diagnosis is normally made by ultrasound. So we'll do an ultrasound, and then we'll see that the uterus is empty and the ectopic pregnancy. At times, we may even be able to see the ectopic pregnancy outside the womb. In some instances, some women come to the emergency unit because they have bled excessively. And some don't even know that they are pregnant. So they are coming to hospital because they are bleeding in the abdomen and they have collapsed at home. We'll do a pregnancy test, it's positive. We'll do an ultrasound, we'll find a lot of blood in the abdominal cavity. And in some instances, you may or may not be able to see the ectopic. And in some instances where one can't see where the pregnancy is, the pregnancy test is positive. And where is the pregnancy? In rare instances, we do a laparoscopy where we put a camera into the abdomen to try and locate where the pregnancy is. So those are the modalities that we have in which we can be able to investigate and make a diagnosis of an ectopic pregnancy.
So, how common are ectopic pregnancies, and who are most at risk of developing one?
Fortunately, statistics tell us that ectopic pregnancies are probably present in 1 in 100 pregnancies or 1 in 200 pregnancies, which is statistically 0.5 to around 1% of pregnancies, which fortunately sounds is relatively rare. And people who are some of the risk factors for an ectopic pregnancy include age. We tend to find it more common in people who are advanced age, probably 35 years and above, people who have had a pelvic inflammatory disease, people who have had infection before, or people who have had an ectopic pregnancy before. If one has had an ectopic pregnancy, there is almost a higher chance that they could develop an ectopic pregnancy, which is the chance is higher than somebody who has not had it before. And of course, people who are probably taking oral contraceptive, that slightly tend to increase the risk of an ectopic pregnancy. And in people who have an intrauterine contraceptive device, in this particular case, the contraceptive device is sitting in the womb, and therefore the pregnancy won't be able to reach there, and therefore the pregnancy either grows probably in the uterus, sorry, outside the uterus, and does not grow inside the uterus.
All right. So, and what about family history? Does that have anything to do with it?
Family history is extremely rare, and that is always subject to a discussion. You may find that there are people who have an abnormal problem with their lungs, and therefore there's something we call cilia, something that the little fingers that move the pregnancy from into the tube. So if that is damaged, and therefore it can be able to run in families, but that of course is extremely rare. But there are instances where that can run in families, but it's an extremely rare incidence where we have a problem with what we call as cilia, and therefore the motility of the fallopian tube gets affected.
So, Dr. Tom, how is ectopic pregnancy treated? What are medications that one needs to take if it's medicinal required? Where can one go for treatment?
Now, the treatment, once the diagnosis has been made of an ectopic pregnancy, now the treatment can either be what we call as conservative, where you want to save the tube, or surgical. The surgical method, most of the time, if somebody comes, they are bled out, the abdomen is full of blood, that's an emergency. We take them to theater and do an open procedure, which we call a laparotomy, look for where the ectopic is, stop the bleeding, and clean the abdomen out. In a case like that, that is a surgical laparotomy where we open and go inside. If the ectopic pregnancy has not ruptured, or the rupture is very small, then we do a laparoscopic procedure which is keyhole surgery. The advantage of keyhole surgery is one recovers quicker and it does not leave a big scar. So those are the surgical methods. And in instances where the ectopic pregnancy is found very early and it has not ruptured and it fulfills particular clinical criteria, we could administer some drugs which melt the ectopic. There's a drug we call methotrexate. Methotrexate is a drug that is used to treat cancer. But when it's given in small doses, it will melt the ectopic, and the ectopic will shrink. And therefore, in a case like that, one doesn't have to do surgery, but we use the injection to melt the pregnancy. So those are the modalities that we have that are available to manage an ectopic pregnancy.
And clinics or hospitals?
Now, the ectopic pregnancy is best managed in a hospital where surgery can be done safely. So most of the time, if we find that one has gone to a clinic which is either managed by a person who does not know how to do surgery, then it has to be referred to either a secondary or a tertiary hospital where surgery has to be done, because it involves having a trained anesthetist, having a trained surgeon who is experienced in doing that procedure, because surgery has to be done in a safe environment. So most of the time, ectopic pregnancies should be managed in an environment where there are medical professionals who are able to manage it and manage it safely, and they're trained to do it. So it may not be done in a clinic where one may not be able to follow up the pregnancy, because it is important to know that ectopic pregnancies is a dangerous medical condition. It can easily kill. And there are many people who have unfortunately succumbed to an ectopic pregnancy because they bleed in the abdomen, and nobody knows why they're bleeding, or the diagnosis has not been made. So it has to be done in an environment where surgery can be done and done safely.
All right. Well, thank you so much once again for your time, Dr. Tom, and for that knowledge and insight. It's definitely something that I wasn't really clued up on, but now I have a little bit more of an idea. Thank you, and have a wonderful day.
Thank you. Thank you. You too. All right.
Right, that was Dr. Tom Mokaya, an OBGYN from Netcare Hospital in Sandton. He's taking us through ectopic pregnancies, what it is, how it's diagnosed, the symptoms, as well as the treatment available for it. If you would like to know more, you can send us a message on WhatsApp. The number is 061 and we'll gladly refer you to Dr. Tom or any of our other medical professionals to assist you in whatever way you would require. But that's the end of that interview. Stay with us. We will be right back with the competition.
Should start calling him our resident.